This is a patient who presented with cough and fever. Frontal and lateral radiographs of the chest were obtained. The frontal radiograph demonstrates a rounded consolidation with an air fluid level in the right mid-lung. The lateral radiograph demonstrates similar findings and locates the consolidation to the superior segment of the right lower lobe. Sternotomy sutures are seen, suggestive of previous cardiac surgery. The patient went on to have a CT scan as well as a biopsy, which grew multiple gram-positive rods in clusters. The imaging and pathologic findings were consistent with a lung abscess. Lung abscesses may occur as a complication of untreated pneumonia or may occur secondary to infection of pre-existing lung cavities in the setting of previous tuberculosis or sarcoidosis. Lung abscesses are divided according to their duration into acute, which is less than 6 weeks, and chronic, which is more than 6 weeks. The presentation is usually nonspecific. Symptoms include fever, cough, and shortness of breath. Peripheral lung abscesses may also cause pleuritic chest pain. In some cases, erosion into a bronchial vessel may result in a sudden and potentially life-threatening massive hemoptysis. Thanks for watching. Please like and subscribe for more videos like this.